Okay, well, welcome everyone to the second day of the second annual Joining Our Voices virtual symposium on envisioning the future of serious illness care. I see we still have folks joining us, so I'll talk slower as they're coming in and adding their audio and video together. Real quickly, I will say I am Heather Altman, the Executive Director of the North Carolina Serious Illness Coalition, and we are thrilled you are joining us for the second of 5 sessions. We have one each day of what we hope will be engaging and thought-provoking experiences. Today through Thursday, the sessions are from 8:30 to 9:30 a.m. and Friday is from 11 to 12. Please take a moment to put your name and your organization, if you're coming from an organization, in the chat line. You can also use the chat throughout the session if you have questions. We just ask that you keep your microphone muted. If this is your first time joining a coalition event, the North Carolina Serious Illness Coalition is a statewide partnership to advance the quality of life and quality of care of individuals and families touched by serious illness. Through collective engagement of our active work groups, we address clinical practice and quality, advanced care planning, caregiver and patient engagement through a variety of communications, advocacy, and education efforts. You are all welcome to join the coalition, and to learn more about the coalition, you can go to our website, www.ncsicoalition.org, and I'll have that in the chat line again. Or you can drop me a note in the chat and I will add your email to our listserv. Many thanks to all of the coalition members for developing this symposium. Each work group focused on a special day and panel, and so a special thank you to the Caregiver and Patient Engagement Work Group for putting together today's session. And with that, I'm going to turn it over to the session leaders, Karen Appert and Sue Deaton. Thank you and welcome.
Thanks, Heather, and thank you all for being here. I'm going to jump right in so we can get to our really interesting panel discussion. I'm Karen Appert, chair of the Caregiver and Patient Engagement Work Group of the Serious Illness Coalition, and we work on projects that advocate for better supports for caregivers of those with serious illness across the lifespan in North Carolina. We meet virtually every month at the breakout sessions that we have during the Serious Illness Coalition meetings. And just in case anyone on this call has not been part of our work group or has not been part of the Serious Illness Coalition, I'll go ahead and put my email in the chat in case you want to become part of our group. And this group has been discussing integrating the caregiver as part of the healthcare system over the last few years. So we're really excited about this panel discussion. And I would like to introduce Sue Deaton, who is going to be moderating this session. And Sue has been part of the Caregiver and Patient Engagement Work Group over the last few years. In fact, was the original chair of the work group. So she started us off on a great direction. And the momentum that we have now is in a big part because of what she did to start the group. So Sue is the CEO of Patient-Centered Innovation, a company that offers professional services designed to promote patient, family, caregiver, and community-centered care. She received her BSN and MSN from East Carolina University and has over 40 years of healthcare experience. As a lifetime resident of Eastern North Carolina, Sue is passionate about human-centered design that intentionally engages the voices of patients, caregivers, and communities at all levels of decision-making. So Sue, welcome, and I look forward to your moderating this session.
Thank you, Karen, and it is indeed an honor to be here today with so many voices and hearts and minds and hands who are dedicated to the topic of advancing support for caregivers in our state, nationally and internationally. So today we're going to have a compelling panel that will share with you wonderful information concerning a model that's working to actually demonstrate that level of commitment to caregivers that we all want to see in our state. I'm going to spend just a few minutes framing why caregiving matters in North Carolina and why it matters now. And then we'll jump right into the panel discussion. We'd like to have this be somewhat of a fireside chat so that you get an opportunity to not only hear leaders talking about the VA Caregiver Support Program, but how this ties to all of our commitment to supporting caregivers. We'll have time for questions and answers at the end, and then a little closing that to send you off with some inspiration and some charge as it relates to this topic. While I'm giving you the frame, please feel free to place into the chat box your thoughts concerning why caregiving matters to you. So I'm going to start, first of all, with some of the realities. And if you did not have an opportunity to hear yesterday's session, please do go back to the North Carolina Serious Illness Coalition website and click on that recording. The panelists did an excellent job of framing some of the realities of what's happening relative to caregiving, and not just in our state, but nationally and internationally. We know that the demographic shifts in North Carolina are creating an unprecedented demand for caregivers. Many of these caregivers are not only having difficulty accessing the services that they need, but the wait list for existing resources is so long that there's not a relative confidence that they will even be able to access those resources in the time frame that the person they're caring for needs them. The pandemic just exacerbated the lack of access to social services, social support, and in-home services. And for many patients and caregivers, those stressors remain even as we've reduced some of the burdens of the pandemic. What we've seen from listening and looking at the experiences of caregivers is that providers frequently leave caregivers out of the conversations with patients, and many times don't even acknowledge their essential role in the care of the individual with serious illness or disability. We don't want to disrespect or dismiss the fact that many organizations have educational materials and online services for caregivers, yet we know from hearing the voices of caregivers that they many times cannot access these online resources, either due to limited broadband access, or maybe just IT literacy. Our state does not have a council or coalition that's dedicated to collecting and analyzing caregiver data. We have many organizations that are looking at caregiver needs, that have subgroups or small subcategory teams that are working on this. But we, unlike some states who have formed dedicated caregiving task forces, we don't have one group that is solely advocating for the needs of caregivers. But probably one of the things that is the most significant to point out is there's this national momentum. There are a number of things that have happened just in the last few years. The executive order and the national strategy relative to supporting caregivers, the CMS rule to pay providers for training caregivers. There are a number of various supports that are happening on the national level. So I think it's really critical that we recognize that this is not a when do we do this conversation. This is a how do we do this. Let's go ahead and get started. So in the North Carolina Medical Journal early this year, the esteemed Dr. Erin Kent was primary author, and many of us on the call today were co-authors in an article that spoke to caregiving as a lifespan issue. And in this article, there were 10 very specific, concrete examples of what we could do collectively in this state to advance support for caregivers. Things like establishing a caregiver task force or finding ways to have mutual aid systems of caregiver support across counties. We know that there are disparities. There's variation across counties. So in one county, a caregiver may have access to a service, whereas the bordering county citizen may not. There are costs and burdens associated with caregiving that we do not fully understand. So we need to study the needs of care recipients and care providers in order to fully appreciate the impact of what would happen should we enhance the resources directly to caregivers, or more importantly, if we continue to ignore those needs and not address those gaps. Disparities in care are just as significant for caregivers as they are for patients with serious illness in this state. So having a really clear understanding of where those disparities exist and being able to address those disparities is a critical element of a strategy moving forward. And then looking at how state and private sector employers can support employees who have substantial caregiving responsibilities, and we know that that impacts their ability to deliver at work. So we're going to end, before we start the panel discussion, with what I like to do to really get folks kind of charged up. So where are we headed? What's our vision? So we want to become a top-rated state relative to how we support caregivers, those caregivers of citizens with serious illness and disabilities across the lifespan. This is not just an aging issue. It's not just an end-of-life issue. It's a lifespan issue. And the article that was published earlier this year in the North Carolina Medical Journal makes a compelling case for how we view this issue as a lifespan issue. So let's think about this vision as you hear from these esteemed leaders talking about a reality of how one organization is demonstrating support for caregivers. So I'm going to start by asking each of the panelists to introduce themselves briefly. I always love to hear people introduce themselves because we find out what they want you to know about who they are, their titles, their lives. And so I'm going to start, Jenny, with you, if you'll please introduce yourself, and then I'll move on to Kate and Charlotte.
Okay, good morning, everyone. Thank you for having me. I'm Jenny Thompson. I'm an occupational therapist with the Durham VA Caregiver Support Program. And in my professional and educational experience, I've found that working directly with caregivers just demonstrates so much benefit rather than simply focusing on the patient or the veteran as an individual. In my personal life, I'm also the parent of an almost 2-year-old with cerebral palsy and several other medical diagnoses. So I bring that perspective as well.
Thank you, Jenny. We'll look forward to hearing from you in just a minute. Kate, would you introduce yourself?
Sure. Good morning. First, thank you so much for inviting me to be here today. I'm an assistant professor in the Department of Health Policy and Management at Johns Hopkins School of Public Health. But I've had the privilege of working with the VA Caregiver Support Program Partnered Evaluation Center since its inception in 2014, when I started as a project manager. And I'm just really grateful to be able to continue working with the Partnered Evaluation Center and in the VA.
Great. Thank you, Kate. Thank you for joining us here today. And then last but not least, our own Charlotte.
Thank you, Sue, and good morning, everyone. I'm Charlotte Sweeney. I live in Raleigh. I grew up here, and I have practiced medicine. I'm clinically retired. I have been a patient myself, a physician, and a caregiver. And I can say by far the caregiver role has been the most challenging, and I'll speak to that this morning. So I'm very pleased and humbled to join this group. So I look forward to it. Thank you.
Excellent. Thank you, Charlotte. And in order to facilitate as much of I like to call fireside chat as possible, I'm going to go off slide and begin asking each of the panelists a series of questions. Please use the chat box to put your comments and questions in. We'll get to those at the end. But let's start with Jenny. Jenny, tell us just a little bit about the VA Caregiver Program that's in Durham. What is it? What kind of program services are offered? What kind of benefits are there to caregivers. What do you want us to know about that program?
Sure, thank you. So the VA Caregiver Support Program, it was first established in 2010 to meet the needs of family caregivers of veterans that served in Iraq and Afghanistan, but it's intentionally expanded over time to include veterans of all service eras. So there are two primary programs within caregiver support. One is known as PCAFC, or the Program of Comprehensive Assistance for Family Caregivers. So this is probably the most widely known of the VA programs. It provides a monthly stipend for caregivers of veterans with serious injury or disability living at home. So these veterans, there's a series of eligibility criteria. A primary one is that veterans must be 70% service connected or higher, and require caregiver assistance with activities of daily living, and or supervision, protection, or instruction. The second program is known as PGCSS, and this stands for the Program of General Caregiver Support Services. And this program has a much broader eligibility criteria. So caregivers can participate in PGCSS if they are caring for a veteran, supporting them in at least one ADL or IADL. There's no stipend associated with PGCSS, but both programs offer a wide variety of supports and resources, including access to respite care, access to educational and training resources, supportive services, access to mental health care. And for our PCAFC caregivers, if they are not covered, if they do not have access to health insurance, the VA program can provide that as well.
So, wow, that's a pretty robust list of services and programs. How did you come up with that list? How did the program design that list of services?
Well, my understanding is that so caregiver support was created from a mandate from Congress, and they sought feedback and input from veterans organizations and caregiving organizations, and just by getting hearing from caregivers themselves about their needs. Also looking at research around caregiving as well.
I'm especially thrilled to hear that it was informed by the voices of caregivers, because when I was listening to you sharing that robust list, I'm thinking that's a wish list for many caregivers. It's a wish list in terms of having access to those services. How exactly do they get access? So in terms of getting to the various benefits that you just listed, how does that work? What's the process?
Yeah, so the process is dependent on which program the caregivers participate in. So for the PCAFC program, the program with a stipend, caregivers apply online, and then there's a very standardized application process. So those caregivers are if their applications are approved, they're connected with what's known as a caregiver support coordinator. So this is a VA staff member, typically a social worker or a nurse, whose role is to help answer questions, to help guide caregivers, and to help support them in their caregiving journey. VA has also set up what's known as the caregiver support line. So this is an 800 nationwide number. I think that it operates It's open 6 days a week for 10 hours a day. So caregivers can call that number at any time and reach a VA staff member that can help answer questions related to caregiving and to point folks to resources.
So that is, again, another wish list that we hear frequently from caregivers. Gosh, I wish I had somebody that could just coordinate, help me figure out where to go and how has that been utilized? Are you seeing that uptake being not only maximized, but what are some of the things that you've seen as a result of having a dedicated line and a coordinator? How does that translate into their experience and access?
Yeah, I think that just in so many different ways. So sometimes we see folks that get connected to VA because they're hearing about caregiver support. A lot of times we can point them to resources that they may not be aware of. VA is a broad, very large system, very complex. A lot of times we can point folks to resources that they weren't aware of. And I think we've seen, and I think others on this call can speak to the benefits of improved outcomes of involving caregivers in the healthcare coordination and involvement with medical providers in the care of veterans.
And I'm listening. I wrote down the adjectives that you use, that the VA is large, it's complex, that many times caregivers don't know what they don't know. I don't think those adjectives would be different for any other healthcare setting. And I think the fact that the VA has chosen to address these very clear, specific, needed resources is just a testament to their having identified a problem and done something about it. What else do you want us to know? We're going to move on to Dr. Miller in just a second, but what else do you want us to know that would help frame in the participants today, their mind, the scope and the depth of this particular program?
Sure. Yeah. So I would like to just let folks know about how broad the program is. So VA Caregiver Support Programs exist at every VA medical center across the country. I just have some numbers here. So there are currently 50,000 plus veterans that are enrolled in PCAFC nationwide. So that's the program with a stipend. And in our PGCSS program, there are currently 55,000 plus caregivers enrolled. So those numbers are very large. Our caregivers are a very broad population that reflect our society. And yeah, I think that these kind of numbers make VA program the largest public program in the nation that directly supports family caregivers.
I think we should all pause for just a second. 50,000 plus. So we're not talking about 100, 1,000, even 5,000, 50,000 nationally. What a compliment to you, Jenny, and the work that you're doing within this program. Thank you for giving us that really great frame. I want to come back to you in a little bit later in the panel, but I want to get to Dr. Kate Miller. Kate, what have you been doing relative to the research on this program to just put a fine point on what this program has meant in terms of outcomes and impact?
Sure. So the VA Caregiver Support Program Partnered Evaluation Center is a team, an interdisciplinary team of researchers. And so we have conducted multiple evaluations of the program, focusing on different domains. And we also use multiple methods. So quantitative as well as qualitative research to help us better understand some of the nuances. And the research that has been conducted to date has really fallen into three categories. The first of which is focused on veteran outcomes, the second, which is focused on caregiver outcomes, and the third of which is really focused on the field, the individuals implementing the program, what their challenges are, and how to address heterogeneity in program implementation. With regards to the first domain about veteran outcomes, a lot of our work to date has looked at veteran healthcare use and costs. And what we found is that being in the program is associated with a higher likelihood of primary care, specialty care, mental health care, other long-term care that's provided in the home. And these are generally outcomes that we might think of as good use, just using that term very broadly, right? If someone needs more mental health care, it's often considered a good thing that they then have higher mental health care service use. One piece that comes along with that finding is that we also see that people in the program have higher costs, higher healthcare costs that the VA incurs. And when we look at the breakdown of costs to really delve into what's driving this, we do find evidence that it is this outpatient healthcare use. And so that research was done looking at the earlier years of the program. So when it was still restricted to just caregivers of veterans who served post 9/11. And currently we have an ongoing evaluation looking at the newer cohort of veterans who are now older and looking at how the program may impact nursing home use. So that's underway right now. And with regards to caregiver outcomes, when we look at caregiver measures of well-being, for example, we had a pilot sample that looked at depressive symptoms, and we found really interesting results that people in the program over time, they still had an increase in depressive symptoms the longer they were providing care. But that increase was not as large as the increase we observed for people not in the program. So it wasn't that the program necessarily reduced depressive symptoms overall, but it did seem to have some attenuating effect there. And we also looked at how caregivers use and value different components of both the program of comprehensive assistance of family caregivers and the program of general caregiver supports and services. And one takeaway that we found in both cohorts was that people who use services found them very helpful. But we often observed a low percent of caregivers who were actually using services. And so qualitative research delving into if these services are so highly rated, like what are the barriers to access? We found some really interesting results. Sometimes, particularly in the program of general caregiver support services, caregivers were not aware of certain services that they may have been eligible for. And then there were also sometimes challenges in accessing services. Respite, for example, was very highly rated, and yet relatively low percent of caregivers were using it. And when we spoke with caregivers of veterans who served post 9/11, many of whom had a diagnosis of PTSD, the caregivers noted that sometimes arranging for respite care was so stressful for the veteran and kind of the aftermath, they actually opted not to use respite at all, even though they acknowledged that it was of value. And so then finally, when thinking about the program implementation aspect of it, we have conducted formative evaluations on the different application processes, especially focusing on the earlier years of the program implementation, which has helped inform the standardized process that Jenny mentioned, which has been revised since the program first began in 2011. And then in 2020, the program of general caregiver support services underwent a transformation in really rebranding and trying to engage with caregivers. And we are currently conducting several evaluations to see how that has impacted measures of caregiver health and well-being. And then, so I think the takeaways from this for other potential healthcare systems are thinking carefully about what costs may be expected to increase. And then also thinking about which caregiver outcomes may be impacted by different interventions caregiver self-efficacy has really emerged as an interesting outcome. That's not one that we see a lot in the literature. And regarding implementation of the program, the central office has implemented practice of community calls and additional documentation to try to support standardized implementation of the program.
Wow, I was taking notes and then I was just fascinated by the rigor, the discipline, the commitment to learn from what you've done within this program. I'm so grateful that you and the VA have been willing to not just study this issue, but to constantly look for opportunities for improvement once you get the data, and it leads you to looking at areas for kind of the next stage of development. Any hints that you can give us as to where this is going, where the data is leading you in terms of ongoing improvements in the program?
Yes, so the analyses are still ongoing, so there aren't any preliminary results to share right now, but the areas of focus right now are among the older veterans who are now eligible for the program, looking at their institutional long-term care use, like nursing home placement, is really a key area of interest, and of course those associated costs. We are also doing a lot of evaluation work focused on respite services, as well as community healthcare workers services.
Excellent. And we heard yesterday in yesterday's session the importance of the design of where individuals go for care and services. And so that combination of thinking around whether or not these services actually create space for unique ways of caring for veterans and also their caregivers. So I'm just so incredibly impressed with what you've been doing relative to the research. Any last comments before we go to Charlotte, who's going to give us a lived experience?
Oh, I'm excited to hear what Dr. Sweeney has to say. Thank you.
Great. Thank you, Kate. Charlotte, you have had experience as a caregiver. You've had experience with this particular program. So tell us a little bit about what your experience has been like, and then feel free to comment on anything you've heard as Jenny described the program itself, or as Kate described some of the data analysis.
Thank you, Sue. I encourage everyone to look at the link that Jenny, I think, put in the chat. There is a wealth of information online, and just taking a few minutes to go through, or actually take as much time as you want, because the information is deep and broad and instructive, whether you are a caregiver of a veteran or not. It is rich material that anybody can appreciate. And I want to compliment the North Carolina Serious Illness Coalition and our particular caregiver and patient engagement group for being open to my speaking to the VA experience. This is a model program, and they're far ahead. The VA program is far ahead in its innovation, research, outreach, and they're working harder, I think, to spread the word. The VA is good at hiding its wealth under a bushel basket. We hear about all the bad things, but we really don't hear enough about the good things. From my personal experience, I want to put in context, if I may, that I think will give a broader picture here. When I started preparing for this panel, I saw myself in a new way, and that is, I've been a caregiver since my youth. I took care of my mother, who had severe rheumatoid arthritis and depression, and was in and out of hospitals and all. And that was from the time I was a little girl until she died 60 years later. My father had cancer and dementia, and my brother had a illness and sudden death. Went through all of that, and without this support, without this wonderful support that the VA has. So I had a lifetime of growing into the role, and it continues to be a process. It wasn't surprising then that after that period of time, taking care of these issues while I was maturing and working and marrying and starting a family, I had an emergency surgery and was off my feet for months. And as soon as I got back on my feet, my husband was diagnosed with a chronic life-threatening disease and service-related disabilities. So he sought health care at the VA in 2013. And I think you have heard that the Caregiver Support Program was initiated in 2010. So we were able to see this from the beginning. The first thing that struck me was that right away, we had a social worker who helped us work through advanced care directives. That was a big thing on my radar, and that made a big difference to me. I did not realize, I was so overwhelmed with what I was facing with my husband's situation that I did not realize that the two programs that were involved in caregiver support, and really felt that we probably didn't qualify for very much. But what I discovered was that the core of VA's Caregiver Support Program is the General Caregiver Support Program. And I'm not excluded from any services except for those that qualify for the most extensive care. So I want to tell you that I have been able to participate in skills training and telephone support and online and in-service programs, and referrals have been made available to me as a resource. And most recently, I'm taking advantage of the peer support, mentoring, and the coaching, which is fabulous because all of us need a wife, you know, to take care of all of this. It's just too much for one person. My immediate plan is to explore VA resources for aging in place in our home. So yesterday's presentation was particularly vital, and I hope that we can share information between the community and the VA. I feel that we've come a long way in the VA Caregiver Support Program, and I've come a long way since I cared for my family. But to be fair, my husband and I are a bit older now, and we can use all the help we can get in this season of our lives. So I am extremely grateful and thankful. I can give you some lessons if you'd like that I've learned over a decade, and they're just a few. I want to emphasize that the VA is ahead of the curve in healthcare innovation, listening to patients and caregivers, informing policies and procedures in general. And I do volunteer as a caregiver voice on a research panel, which is the joy of my life. I just love it. Specifically, even though the VA in general is so ahead of the curve, I think it's important to understand that every VA medical center is a standalone hospital. It has its director and local administration, and even though each must follow the Department of VA's laws and regulations, each director has his or her style and prefers to emphasize some programs more than others. And of course, staff expertise may vary across the country and in individual hospitals. The VA electronic medical records predated the commercial market, and its EMR has been invaluable for us and continues to improve its services. When I'm stressed and I have a list of resources or to-do list may seem overwhelming, it is so timely to have an assessment of my stress levels by qualified staff. That's been invaluable to me. That helpline is a huge, tremendous benefit. And the VA is continuing to try to help caregivers with assessment of their needs and how they can be more successful. I do initiate requests for services, and I want to emphasize that spontaneous suggestions and offering from the staff are occurring more frequently than they did when I was first in the program. Of course, the program is ballooned. But I do continue to find that being a polite, persistent, squeaky wheel is helpful sometimes. Time and redundancy of paperwork and appointments for qualifying for programs and or for disabilities can be daunting and discouraging. It takes resilience to stay on top of all that's required at times, not unlike insurance coverage in the civilian population. But once my husband and I learned the VA system, overall, it's efficient and the personnel are polite and respectful. Every veteran, much like civilian patients, benefits from having support in each consultation, if that patient allows. So taking notes, asking questions of healthcare professionals, having timely telephone access to providers, rather than getting a recorded message without any follow-up. Having my husband recognized and respected as the captain of his healthcare team, with me as his support, are also invaluable. My showing up, being a team player, taking baby steps, building on my strengths, recognizing and strengthening my weaknesses thanks to the help from the VA caregiver support, showing gratitude often, expressing vulnerability when I need assistance. All of these help. I am so grateful that I am so far a pretty successful squeaky wheel. And I want to tell you all that on the whole, my husband and I are very happy and grateful for VA healthcare and the VA Caregiver Support Program, because we know what it's like not to have either one.
Well, Charlotte, I am, first of all, so honored that you were willing to share your story, to share your experiences. I think you clearly have painted the picture that the VA is an early adopter, innovator. You mentioned 2010, folks, that was over a decade ago. So this program has been in place, and I think someone may have said it earlier, where the VA is generally keeping their light under the bushel, so to speak. But I think what you're going to see and hear through the research that Dr. Miller shared, through Jenny, the advancements, the ongoing services, and Charlotte, through the various descriptions that you've given, that we're going to hear more about this. And I think the important takeaway for the day today is that we not look at this and think, okay, this is the VA, and somehow this is something that the government can do and we can't do. Oh no, there's so many opportunities to translate this work into your particular area. So let me just ask, for those that are on the call today, I want you to think for just a minute. What have you heard today that you think you could do in your program, or what do you need to know in order to look at what the VA caregiver program has done and consider implementing a similar structure? And as you're doing that, as you're putting your thoughts and comments, just one thing that you can do in the next 7 days or the next month. I want to go back to Jenny, Kate, and Charlotte one more time. One of the things that I've heard kind of a thread throughout this program is there's a community that's been created, this sense of commitment to the caregiver as an essential partner. Tell me a little bit, Jenny, about where you think that community has made a difference in terms of elevating the value, importance, the respect, the recognition of what caregivers bring to the table. And then Kate, where you think the research is helping us better understand why we need to continue to focus on caregivers. And then Charlotte, you can close with just how do you see this community matters to so many other veterans. Jenny?
Yeah, thank you. So I think the VA emphasis on caregivers across the system is very unique. Excuse me, the VA in let's see, March of 2023, they they changed, they updated the VA's mission statement. It hadn't been updated since 1959 before that, but now it states to fulfill President Lincoln's promise to care for those who have served in our nation's military and for their families, caregivers, and survivors. So that updated language now explicitly includes caregivers as part of the VA's mission itself. So I think that that just speaks to, the openness and the collaboration with caregivers that's so important.
Excellent. Kate, where do you see the research taking us in terms of creating this even more robust sense of community and focus and respect for the caregivers?
Yeah, so with regards to the direction of the research, one thing that I think is so special about working in the VA is that the research questions, the evaluation questions that we develop, I mentioned as part of the interdisciplinary team, we don't develop alone. We do it through conversation with the operational partners. And that allows the research to obviously, we bring our own investigator-driven questions that we think are most interesting and most relevant. But then we get to have this back and forth with the program office who may say, yes, that's really interesting, but here's how it ties into our operational needs, really in support of the mission, as Jenny mentioned, to provide the best care to veterans and to their caregivers.
Excellent. Great. Charlotte, before we go to Q&A, what are your thoughts about how this sense of community through this program, through access to services, to being able to see yourself as part of a group that's respected and valued? Where do you see that mattering?
Well, the VA is also US, it's us, all of us. And I think the community care, the fact that our veterans are now an extremely small 1-2% of our population, when in World War II, for instance, there was the draft. Everyone knew a veteran or had touch with a veteran. Now we're in a different era. The veterans are a small number, and it is more incumbent on us to be incorporated in our communities and to share the information. We need one another desperately to build and support and reinforce the care that we have for one another. So I am impressed with how well the VA listens, and I think that's huge. We have 2 ears and 1 mouth, and I think the VA is learning that at an accelerated pace, and I am extremely grateful.
Awesome. Well, we've had a number of comments and questions in the chat box. I think one of the things that I'm seeing as a thread in the chat box is that there's interest in specific elements, and thank you for those that have posted links to articles, to resources. I want to put a fine point to something I've heard and then ask a question. I think Linda Smith, you posed a couple of questions specifically as it relates to where we can translate this information into the civilian world. And one of the things that I'm seeing over and over again is the VA accelerating their interest in getting information like this out. So I'm hearing and seeing not only the research being published, but presentations being offered across the nation and actually across the world relative to the VA's work in building highly reliable organizations and how that high reliability translates into programs such as this. I would strongly encourage everyone on the call today to not only go in and look at the links to the various components of the program, look for the research as it's getting published that Kate's referenced. Think about this in a very practical way. What can I learn from this? What can we do to increase the voices of caregivers at the table when decisions are being made in planning, implementation, and evaluation of programs and services? how can we set up a coordinator or collaborator role in our system? Just start small. Can we do that in one area and then expand it? Is it possible that we can offer a 1-800 line, or a line where caregivers can call in and say, I need access to this, this, and this? Can we use existing call lines? You know, Linda asked, will this model and a general description of how to apply it in the civilian world be made available over time? I'll throw that question out, but I'll also say, go after the resources we've given you today and look at the various components and pick something and get started. Do something. That's something a patient advisor told me one time, just start somewhere. But anybody want to comment on how this might apply in the civilian world? Do you see any real barriers to doing this in the quote civilian world? I'm seeing Charlotte shaking her head. Charlotte?
I think the VA has an advantage because it's one system. And even though it's unwieldy because it's huge, it's also very flexible because of this local application and listening on a local level to implement national policy. We're all unique. You know, my situation is unique, and each caregiver situation has to be, or ideally would be matched need for need, right? So coming together is extremely important, as well as having the local voice heard. So in my mind, every hospital, every doctor's office, every care facility needs to have a voice of the consumer, of the patient, of the caregiver. And we need to keep harping on that so that these voices are heard and can be directed towards needs that are right there. That might not be a national need, but a local need.
And that's a really very specific, powerful way to get started. If you're not sure where to start, ask the individuals that need to be served. Jenny, you had your hand raised?
Yeah, I was just going to add, and Dr. Miller spoke on this a little bit as well, but there's obviously a very large financial cost that accompanies this program. So I looked up the budget, the annual budget for fiscal year 2024 for Caregiver Support Program is $2.4 billion. So that's just a huge number. And I think, as Charlotte mentioned, the VA being one system and being a fairly, I guess, the needs of caregivers and veterans are especially forefront in our country, and veterans are a fairly sympathetic political audience contributes to that, and there's not necessarily the same supports, in other areas of the country.
Kate, any thoughts on that?
Yeah, I would just echo what's been said about the VA being a large system, which does provide, but we do have this flexibility across individual medical centers. I think one thought that I would just put out with regards to how this could be translated into civilian healthcare systems is the standardized assessment that the program uses for caregivers. It has been modified to be unique to the VA, but when we were developing some of those assessments, we actually pulled from many civilian caregiver assessments. So I think there is potential applicability outside of just the VA system, and also using the patient navigator model, which we see in civilian healthcare systems, as a potential template to build a caregiver support coordinator. That system has a lot of potential with regards to identifying, assessing, and then training caregivers. So I think there are opportunities.
Excellent, excellent. Charlotte?
I think in North Carolina, we can follow the model of the Elizabeth Dole Foundation that started and is now part of the VA for research and education and resources for veterans. We could have a statewide that models that effort. and it's worth looking into.
And I think what I'm hearing kind of too as a thread is that let's not let the fact that the VA is a Veterans Administration be the reason why we don't think we can't do it in non-veteran environments. These are innovative approaches that have been modeled in Europe and other countries. We have the opportunity to join the early adopters, the VA and their caregiver program, and really think about how we can learn from them and how we can apply that in our organizations. So we've got about 5 minutes left. So I'm going to wrap up and give the panelists one chance to just give us your pearl, your takeaway for today that you want to leave the voices that are on the call today with. And I'm going to start, Charlotte, with you. What's your one takeaway?
Oh, I have to go with Jimmy Valvano. Never give up. This is so worth fighting for our own personal growth. I can speak for myself, for strengthening marriage with my veteran, our family, and the caregiving support that we have learned for one another. It is just so vital that we continue this effort. And I hope that we can adapt on a statewide level what the VA is able to do on a national level. I think we can do a lot of that.
Excellent.
Thank you, Sue.
Thank you, Charlotte. Kate, how about you? Final words.
Sure. I think caregivers really are the backbone of long-term care delivery in the U.S. And so investing in not only how to identify, but assess and train caregivers on a large scale is critically important, and will just continue to be critically important as our population, I know the veteran population is aging, but also our population in the U.S. more broadly ages.
Excellent. Thank you, Kate. Jenny?
So to me, there's two unique aspects of the VA program. One is the stipend, and I think that this is obviously the most difficult to replicate, but I think that the model of providing financial compensation for caregivers for the work that they do is a shift in the model of how we think about the value of caregiving and its role in our economic system. I also think that respite care, the availability of respite care is just absolutely crucial for caregivers. And I wish that it could be available for everyone. We know all of the benefits of respite care that it can provide for caregivers.
Excellent. Great. I want to just say thank you so much to the panelists today. You've been incredible voices. You've given us not just food for thought, but you've given us a charge as we think about that vision of becoming the leading state in the nation in caregiver support. You've given us some really great ways to think about what we can do tomorrow to start working towards this goal. And I just want to say thank you for what you do every day to advance this work. I'm going to turn it back over to Karen and to Heather.
Heather, you go ahead. I'm still taking notes on the amazing discussion. So I just appreciate and want to say thank you to all our panelists and to Sue for moderating this. I thought it was great.
Mm-hmm. Thank you. Thank you. Yes, to Sue and Charlotte and Jenny and Kate. We're good friends now, so we're going on first names. Thank you so much for sharing. As a family caregiver myself, it is heartening to see all the work that is done and this collective energy. And now let's broaden it to as large a base as we can. Many thanks to you all, to the panel, and to the caregiving and patient engagement work group who worked tirelessly to put this thoughtful panel together. For our audience, thank you for joining us, and please join us tomorrow to learn about exploring the use of video in advanced care planning. On Thursday, we will talk about From Books to Bedside, the Art of Serious Illness conversation, which is all about how we are having our students in the healthcare, medicine, nursing, social work, pastoral care, how they are being prepared to support caregivers and have goals of care conversations. And lastly, thank you, Charlotte, for teeing up Friday's session all about empowering tomorrow, navigating the future with advanced care planning. Both Friday and tomorrow's session are about advanced care planning. And you talked about when you started your caregiving journey, how important having advanced care planning support was. So with that, thank you everyone for joining us. Thank you, panelists. And I feel like it's cliche, but together we're joining our voices. So really appreciate it.